Okay, Nick Slenkovich, Denver Body Doc. We're in Denver, Colorado, Littleton, Colorado, and I've been in practice since 2003. We have a surgery center and we have a practice. We've added our third patient coordinator this year, and we've been with Yellow Telescope for about 6 years now. You know, I met John Hoffenberg at a meeting in 2016. I could tell right away that he was first of all, he's in the trenches with the practice rather than a consultant that just stays in an office and tells you what to do. So a very different model of having been there, done that himself as a patient coordinator, but also that it was extremely service oriented. And as a patient on the other end of that the process really serves patients best. And it goes to all the technical details of it. Every time I come back to this meeting, I really appreciate that we get to test ourselves and get better at that process. But it really serves both parties the best and most effectively, most efficiently, and it respects people's time. And we hear that every day, probably every phone call our coordinators take. They appreciate how much care is put into learning about them, about their goals, and it better serves them. And it's definitely more effective for us as well for that process. So it's great for our practice, great for our business, but great for our patients. Probably took us about a year to actually get it in place. You know, the manager I had at the time maybe was a little resistant, and took us time to figure out, is it worth the money, etc. But I think I really knew essentially right away that it was the right thing to do. So it was just a matter of logistically getting it to happen. Yeah, we've doubled in size, but it's also consistency. It's also selling less or promoting or growing less based on individual person's like style or skill or how they might use their personality, and more based on building relationships in a consistent way, going more to individual needs, goals, and building relationships rather than, again, a personality or emotion. So I think it's honest, it's more needs-based, it's more really based on relationships, and that's very much more what I seek to do. You know, we really seek to partner with patients on their transformation, on their self-improvement journey, and we very much want to learn about a person and what their goals are to see if we can help them, if we can partner with them, because it's a real commitment. You know, if you've hired me as a patient, I feel like now I owe you a lot, like now I've hired you, and so it's a lot of work, and this process sets us up for success with that in a much, much better way than relying on someone who's just kind of using their charm to bring someone in as a patient. So we found it to be optimal. So our team has been coming for the 5 years that we've been customers. This is my second time. I've actually had another meeting at this time of year. I don't make it every year. So we're gonna make it, I think, a commitment. I'm gonna try to get back as many years as I can. It's great, yeah. I think the last time I was here was at least 3 years ago. So it's good just to get a refresher myself. And it's nice to go into the advanced meetings, and they break it up by level, so it's always good. And it's also good because I've got a lot of colleagues that are here, some that I've mentioned and told about YT, and they've come. It's good to see them here, and it's also fun just to be able to talk with other and network and meet other colleagues. I think just the effectiveness, it's a very in our practice is very person intensive. You know, the staff are probably the most important asset we have. It's not the equipment, it's not the building, it's the people. And it was a people-oriented business. It's obviously very service-oriented, and clearly it's a hands-on oriented service that we provide with the surgery itself. So it's people first, and this is a very people-oriented process that we go through. And your techniques are not, that are taught, the process that's taught for the patient coordinators, for the front office staff, all of that is very person intensive and process intensive, so it all works really well together.